Good afternoon, everybody, and thank you for having me. In plastic surgery, if you ask me what one contour could we do with liposuction to make the body look really good, it's getting a really good waist, and this study is about doing that non-invasively. I'd like to thank my sites, Joel Cohen, front row, Carolyn Jacob, Suzanne Kilmer, Stanley Akuro, and Young Cho for also participating in the study and all the sites. You said the left one?
Should be.
Good. Left. Our New Jersey Clinical Research Center is a research site for BTL, and that's what this is about. So I think you've seen this slide already, combining high-fem and radiofrequency, and that's what this study is doing also. There are unique applicators that are curved that are way more powerful than ones like on the abdomen that will go after fat and do muscle tightening. And why is that a big deal? Well, in surgery, with liposuction, all we can do is fat. We really can't affect the muscle also. So this is a really good combination to look at, particularly in the non-invasive arena. So the objectives were adipose and muscle tissue to determine the shape of the waistline. We know that. Abdominal muscle tissue is essential for core stability and posture, which we just saw presentations about. And sculpting plays a big role, and now both muscle and fat to get a nice waistline. And the current methods are cryolipolysis, surgical procedures, as I said. So in the combined study sites, we had 73 patients enrolled, 66 were treated, 7 withdrawn. The age range was 22 to 60 years old, BMI 20 to 33. Skin types were 1 to 4. So the treatment regimen was 4 30-minute sessions, 5 to 10 days apart, and then visits after that were at 1 month and 3 months. The primary outcome was to look at changes in oblique muscle characteristics, adipose thickness, cross-sectional area, and this was done very accurately with MRIs. Secondary outcomes were digital photographs of the treated areas, subject satisfaction, and then therapy comfort questionnaire. In this slide, you see the different muscle groups grouped together and looking at baseline 1-month follow-up. So I'm going to just go across the top line there. So at 3-month follow-up, muscle increased by 29%. If you look at the pink line, looking across the top, because there was a front and back to the fat measurements, and fat decreased by about 30%. This is one of the MRIs, so you can see the measurement areas of the fat, anterior, posterior in yellow, and then the muscle thickness, which is the green measurement. So results in the secondary outcome, there was a high satisfaction in treatments. 81% of subjects reported feeling more toned in the treatment area. 77 were satisfied with the results. 75% noticed appearance improvement as well, and 72% more confident in their clothes. When you looked at the comfort of the procedure, it was felt to be very comfortable in the 85% range. So here are photographs. This is a 34-year-old female. 1 month after the procedures, she felt more toned and more confident in her clothing. High satisfaction with the results. Here's a lateral view of a 45-year-old. Her BMI was 23, and she reported a maximal comfort and no pain. So this treatment, which is unique for waistline to get your hourglass figure, pretty much increased muscle thickness and made those oblique muscles tighter, more powerful, decreased fat, both working in concert to get that figure. Very good combination of tissues to treat. 84% reported less than mild pain, so it's very comfortable, and the simultaneous use of the high-fem and the RF really strengthened muscle, reduced fat, and the safety of the combined technology was also confirmed in this study. Thank you for listening.